Hi, I'm Lloyd with the Colorado Learning Center of Human Anatomy. Today we're going to be talking about the lower extremity. We're going to look at the hip, the knee, and the ankle, and the muscles that make them work. Also, we're going to take a look on Harold here to see what those joints look like in the bone. And so in just a bit, we're going to look at our model Andrew, and he's going to show what it looks like in person as we go through the movements. As we talk about the muscles, it doesn't matter whether you're going to be a physical therapist or a power lifter or just an enthusiastic gym rat. You need to know what the muscles are, what they're going to do. And so when we look at how things are organized, the muscles always have to line up with the movement that we want. And to that end, as we look at our donor here, we're going to see that we've got four basic compartments of muscle. We've got the muscles in the front or the anterior, the muscles in the medial or close to the midline, the muscles on the lateral aspect, or underneath we have the muscles in the back or the posterior. Up front here, these are called the quadriceps. The quadriceps have four muscles, quad, but only one of them crosses the hip, and that's the rectus femoris. We also have several other muscles that cross the hip, and that's what gives us hip flexion. That's going to be our hip flexors. Then as we look at the muscles on the medial aspect, that's going to give us adduction, which it brings the lower extremity into the midline. Then on the lateral aspect, we will have our abductors that take it away, and those take it away from the midline. And then in the back, the hamstrings, which extend the hip and also help to flex the knee. At the knee, we have the patella, and I just like to demonstrate that little bit of movement there. And so the patella is going to be pulled tight by the quads and then allowing the knee to flex or pulling the knee into extension. And so let's take a look over here on Harold to see what those joints look like. In the hip, we see a nice ball and socket into the pelvis. And so what that means is it gives us a lot of circular range. It gives us the ability to actually come up and around and out. So that's going to give us a lot of nice movement in several axes and directions. When we get to the knee, however, what we see is really a hinge joint. And so here at the knee, it's going to be just doing one thing. It's going to be flexing and extending. So in and out of that hinge is all it's going to do. When we get to the ankle, we have a complex arrangement of bones and joints. We have those 7 tarsals in the ankle, and they're arranged so that the first tarsal creates our heel, or the calcaneus, and then the others actually allow us to have a little bit of pronation or supination, and we get to point the toes and pull the toes back. So, just take a look at the arrangement of the muscles here. For these hip flexors, what we see is that they're all attaching here into the pelvis, out here on the side of the pelvis, and right in here, okay? All of those are going to cross the hip joint. They're going to work their way down onto the femur, onto the bone of the thigh. And so those hip flexors are all going to be able to pull that knee up and bring us into flexion. And then if we look at the medial aspect, we're going to see that, again, they're crossing, but now they're crossing from here down to the medial side. And we can look at those right here. We've got this nice little spiral, and then this nice straight line of nice long but strong muscles coming right into the pelvis. And then on the outside, on the lateral aspect, we have, again, these nice, big, thick muscles that comes straight down onto what's called the greater trochanter, but it's the outside of the hip bone. This is what you actually feel when you feel your hip bone. That's it right there. That's the bump. And so those muscles are able to pull it out, okay? The hamstrings are what's behind. And so the hamstrings, we're not able to see them on our donor here, but those are what's going to be pulling the hip back. And then as we look at the knee itself, some of the same muscles involved. Hamstrings are going to flex the knee. The quadriceps are going to extend the knee. We've got a little bit of control on either side that crosses the knee. And as we get below the knee, so flexion, extension, remember, that's all we get. But down here now, most of the muscles that control the ankle actually go all the way into the foot. And so we've got two groups of muscles, the extensors on the front of the leg, the flexors on the back of the leg. And as they move the ankle, there's also the ability to roll the ankle into pronation or supination of the ankle. And we can see here, just looking at the tendons, that the muscles here will actually pass all the way from here in the leg, all the way down to the toes or to the arch of the foot. And that means that most of what's happening in the foot is actually from muscles that are all the way up here in the leg. So that's a lot of strength, that's a lot of power generated to create movement all the way down the arch and into the toes. So let's take a look at what that's going to be like in a person. The hip joint is directly below my finger, and as we see the hip flexors, these nice large muscles here, as they work, we're going to see them pull and flex the hip on Andrew, and then the muscles behind are going to extend the hip. Flex the hip and extend the hip. So now as he comes back to rest, we'll see the next group, this medial group, so medial toward the midline. These muscles are going to pull the leg into midline, and then these muscles, or the lateral muscles, are going to pull the hip away from the body. So pull the lower extremity away from the body. So this will be abduction, pulling out. So again, these muscles pulling out, and then these muscles pulling in. So abduction, pulling out, adduction, pulling in. All right? And then the combination of movement is now we're going to see different parts of these muscles firing to rotate externally or rotate laterally. So rotating it, yep, rotating laterally and then rotating medially or rotating internally, rotating laterally there, and then rotating medially or internally. So now, something to point out as long as we're over here, this is the IT band. And so you'll often hear about the IT band being a problem for people. And if you have a foam roller at home and you try to roll this out, you'll notice that it gets really painful on a lot of people. Maybe not on you, but a lot of people really uncomfortable. And that's because one thing that happens is this band, if you're overcompensating in posture, if you tend to stand on one hip or the other, or if you're not balanced as you walk, you'll see that this really tight fascia here will pull right across the knee. And so as you see that, how it kind of glides. It's supposed to glide right across the knee, but it doesn't always do that very well. And if it gets stuck, then it means your knee doesn't move very well, and it gets painful sometimes. So as we're coming down to the knee, the quadriceps here are going to extend the knee, and then the hamstrings behind are going to flex the knee. So as Andrew shows, so extension of the knee, beautiful outline of the quadriceps, and then flex the knee, the hamstrings behind the thigh are pulling in, and then extend the knee, these muscles, and then flex the knee behind. There we go. So now, as we go into the leg, the lower leg, all the muscles in front here are going to be the extensors. They're going to be pulling, and we can actually see that, pulling the toes or pulling the big toe. And so we're going to see them point and then pull back. So the flexors point the toe, the extensors pull the toes back. The flexors point the toes, and the extensors pull the toes back. So hopefully that'll give you a leg to stand on when you're looking at the anatomy of the lower extremity.